Madam Speaker. Madam Speaker, I rise today to share with you a very moving story from Lucius Day of Littleton, Colorado. Lucius wanted me to share the story of their family's experience with health care. Lucius was married 56 years ago. He and his wife didn't have health insurance at that time. Few people did. But within a few years, as many American families, they got their health care benefits provided from their employers, and they always had at least one member of the family who was steadily employed. Lucius, of course, is now comfortably retired, and he has Medicare. But, Lucius writes, his children haven't been as fortunate. Their children have, like many Americans, experienced extended periods of unemployment and part-time employment. They've had extended periods of time under which they didn't have health care benefits and couldn't afford to purchase any meaningful health care insurance. On more than one occasion, one or more of Lucius's kids have been forced to rely upon emergency room health care, for which they were unable to reimburse their provider. Lucius told me that all of the arguments against a government-provided health care option are, quote-unquote, nuts, and they're fundamentally flawed. Lucius wanted me to share with you that we need public health care that covers the basic needs of everyone. And Lucius says if some want more health care, they can buy it, but everyone should have basic health care as a right, not a privilege. Through health care reform, Lucius's kids would be receiving affordability credits. What that means is if you make $20,000, $30,000 a year, or if you're in a family of four, even if you make $40,000, $50,000, $60,000 a year, and you don't get insurance through your employer, it's very hard to afford insurance on your own for your family. So what do we do under this plan? You receive affordability credits. They're vouchers you get that you can redeem for the health care product of your choice. Now, that wouldn't be enough, just that step in today's market, because the cost of buying health care if you're on your own is outrageous, particularly if you have a pre-existing condition. So we take a couple additional steps. One, we create an exchange. What the exchange does is it gives every individual and small business the same buying power as a multinational corporation with hundreds of thousands of employees. So they can get those same favorable rates that used to be reserved for the big boys. The other thing we do is we prevent pricing discrimination and exclusions based on pre-existing conditions. So Lucius's kids would have access, if we can pass health care reform today, to real health care insurance and security for them and their families. I hope that Lucius's story helps encourage my colleagues to understand the human face behind why it's so urgent for us to pass health care reform. Thank you, Madam Speaker.